Do you know that around 5 to 15% of the population contracts influenza every year, more commonly known as the flu? This means around 3 to 5 million severe cases of the disease are being reported globally all over the world. Although the flu lasts for 2 to 8 days with typical symptoms in most patients, these can wreak havoc and be deadly. It can quickly progress to pneumonia, a disease from which about 50,000 people die each year in the United States alone. Welcome back, guys. In today's video, we'll look at 5 interesting facts you should know about flu shots. But before we begin, make sure to subscribe to our channel and turn on the notification button. Never miss another update. Alright, without further ado, let's get started. Number 5. A flu shot doesn't cause the flu. The most popular misconception of the flu shot is that it causes the flu. However, it's not valid. One of the most common and basic strategies to make a vaccine is with killed or inactivated viruses. The flu viruses are grown in a controlled environment. Then, these viruses are killed or inactivated and the virus antigen is cleansed. Other manufacturing processes involve more quality testing, filling, and distribution, making the flu shot safe. Moreover, the Food and Drug Administration tests and approves all flu shots before their release and shipment. The flu shots made by inactivated viruses can even be given to people who have a weak immune system. However, some people do experience mild symptoms after vaccinating that seem like the flu. This is the main reason why people have this misconception. The common symptoms include soreness, redness, and tenderness where the shot is taken. These side effects will begin soon after vaccination and last 1 or 2 days. The symptoms emerge basically because of the creation of antibodies, which ensure that you are safe from the flu. Number 4. A flu jab is completely safe for pregnant women and their babies and effectively protects them. A study published by Oxford University Press for the Infectious Diseases Society of America 2018 shows that getting a flu shot reduced a pregnant woman's risk of being hospitalized with the flu by 40% on average. It reduces the risk of acute respiratory infection associated with the flu in pregnant women by about 1/2. Moreover, several studies also suggest that a flu shot during pregnancy also helps protect the baby from the flu for months after birth, a period during which babies cannot be vaccinated otherwise. Number 3. There is an age-specific flu shot for the elderly. Older adults who are 65 years or older have a higher risk of developing severe complications from the flu. A study shows that in recent years, 70 to 85% of the deaths related to seasonal flu have occurred in people 65 years and older. There are regular flu shots approved for use in people 65 years and older, and also 2 vaccines designed specifically for this age group, called high-dose flu vaccine and adjuvanted flu vaccine. The CDC explicitly mentions that these age groups should get a flu shot and not a nasal vaccine. Number 2. The best time to get a flu shot is in October. According to the Centers for Disease Control and Prevention, it is apt to get a flu vaccine before the influenza virus starts spreading in your community. Usually, the flu season in the US starts during October, peaking from December through February. You can always get a flu vaccine any time of the year, but remember, it won't start working right away. It takes at least 2 weeks to be completely effective. The entire generation of antibodies enough to fight the influenza virus takes at least 2 weeks to increase throughout the body. That is precisely why the CDC recommends the flu jab be brought before the flu season starts. The CDC also warns that getting a jab early, like in July or August, can reduce protection against the flu infection later in the flu season. Number 1. You might need a new flu shot every year. The flu shot prevents you from getting the influenza virus, as we've seen earlier in the video. But do you know that more than 198 strains of influenza A are the most widespread virus alone? Thus, they re-emerge each season in a different form. To effectively combat the flu, researchers adjust the flu shots yearly depending on the common strain during that particular season. This makes the flu shots unique each year. So if you've taken a flu shot, it doesn't guarantee you protection against all the influenza virus strains, even though it effectively combats the strain that is spreading in that particular season. That's all for today, folks. Flu shots are crucial, especially during the time of pandemics like this. Which fact surprised you the most? Let us know in the comments. Subscribe to our channel for more videos like these. Thanks for watching.